Tonsillectomy is an operation that is performed to remove the tonsils. The tonsils are a pair of glandular structures that form inside the oropharynx, which is the area at the back of your mouth. In childhood, it is thought that they have a slight role in helping to prevent infection. But once they become chronically infected or enlarged, they can cause problems with recurrent sore throats and frequent episodes of tonsillitis, affect the breathing at night, causing symptoms associated with obstructive sleep apnea or snoring, and rarely they can also be associated with the development of certain cancers in adulthood. There are three main indications for having your tonsils removed with a tonsillectomy. The first is for recurrent and frequent episodes of tonsillitis that are disabling, causing time off from school or from work. The second is for patients who are suffering from severe snoring or sleep disordered breathing or obstructive sleep apnea. And finally, for diagnostic purposes or as part of treatment for suspected cancers inside the tonsils. Usually, when you come to see a specialist to talk about tonsillectomy, you have already tried a course of antibiotics, but occasionally for some patients who have not, it is possible to have a prolonged course of low-dose antibiotics to prevent against recurrent tonsillitis. This, of course, is associated with its own side effects and risks, and this would be something that would be weighed up for each individual patient. In some patients, when tonsillitis is not frequent enough, we may advise a 6-month period of watchful waiting to see if the symptoms resolve on their own. Tonsillectomy is performed under a general anesthetic with the patient asleep. It can still usually be performed as a day case, except in cases where there is suspected severe obstructive sleep apnea. In these patients, an overnight stay with observation of their oxygen levels is usually required. Under the general anesthetic, when the patient is asleep, a small gag is placed in the mouth to open the mouth to allow the surgeon to peel the tonsils out from both sides gently. Electricity can be used to heat the blood vessels to stop bleeding, and silk ties can often be placed at the inside of the mouth to help tie off any larger blood vessels. Tonsillectomy is usually performed with the aim to prevent a person from having tonsillitis ever again. Very rarely, for partial tonsillectomies or incomplete tonsillectomies, some tonsil tissue can regrow, but once you've had your tonsils removed, you're unlikely to suffer from tonsillitis ever again. But of course, you can still have a sore throat. For young children who have tonsillectomy as part of treatment for obstructive sleep apnea, we expect the snoring and nighttime breathing to improve dramatically after the operation. There are some symptoms that all patients experience after having their tonsils removed. The operation can be quite painful, especially in adults, and usually the pain can become slightly worse before it becomes better. For this reason, most people are advised to take at least 2 weeks off from their work or from school to recover fully from the pain. During this period of time, they'll need to take painkillers like paracetamol, ibuprofen, and even morphine to help control the pain. Bleeding is a frequently encountered complication of the surgery, and 10 to 15% of patients who have their tonsils out will have a small amount of bleeding after the operation. This can be a little frightening, but in most cases will settle spontaneously or by itself. For a small proportion, that is 1 or 2 out of every 100 people that have their tonsils removed, there can be significant bleeding, requiring either a blood transfusion or a second trip to the operating theatre to stop the bleeding. The usual cause of bleeding in these patients' cases is due to a post-operative infection or poorly controlled pain that has stopped them from eating and using the muscles at the back of the throat to allow things to heal faster without infection. Other minor risks associated with the operation include a small risk of injury to the teeth, lips, gums or tongue during the operation, an altered taste sensation because of the operation happening at the back of the throat, and after the operation, the breath does change with some offensive breath for a period of time. Recovery from tonsillectomy can vary quite significantly depending on the age and the type of surgery that is performed. For partial tonsillectomies, whereby a small rim of tonsil tissue is left behind, the recovery can be very quick, with patients being almost completely back to normal in under a week. For patients who have a complete tonsillectomy, particularly adults, the recovery time can be longer and on average takes 1 to 2 weeks. It is for this reason that everybody is advised to take at least 2 weeks off from work or school to completely recover. It is best to avoid going into open spaces or meeting many people to avoid picking up an infection that can lead to delayed healing or even bleeding complications. I hope that you find the information in this video useful. It should supplement the information that you receive in your patient letter, as well as the information leaflet that you'll be provided prior to your surgery. If you have any questions or want to ask me any more information, please do not hesitate to get in touch with us.